cavernous sinus, the lateral wall of the cavernous sinus is now removed. Okay. So this is how it appears. So this is the third nerve entering the roof of the cavernous sinus. This is the fourth nerve which is entering the roof of the cavernous sinus. So this is the V1, the ophthalmic division of the trigeminal nerve. And here you have the trochlear nerve. So what you need to see here is, see how the third nerve, the fourth nerve and the V1 converges to enter the superior orbital fissure. So this is the superior orbital fissure. So the third nerve, the fourth nerve and the ophthalmic division converges to enter the superior orbital fissure. And the other thing which you need to remember is, this is the sixth nerve. So this sixth nerve, it usually lies medial to the V1, the ophthalmic division, whereas at the when it reaches the superior orbital fissure, the sixth nerve becomes lateral to the V1. Okay, the sixth nerve becomes lateral to the V1, that is ophthalmic division, when it enters the superior orbital fissure. So this is what you need to know. The third nerve, fourth nerve and ophthalmic division converges to enter the superior orbital fissure. What you see is the V1, V2 and V3. Ophthalmic division, maxillary division and mandibular division. So now what is being done is, now what you see here is the posterior root of the trigeminal nerve. Now what is being done is this posterior root of trigeminal nerve is being elevated. So it is dissected and it is being elevated. So once you reflect this posterior root of the trigeminal nerve, what you see here is called as the trigeminal impression. This is called as the trigeminal impression. So medial to the trigeminal impression, what you will have the Meckel's cave. So this is the Meckel's cave. Okay, this is the Meckel's cave. So medial to the Meckel's cave. So this arrow marks, this corresponds with the lower border of the cavernous sinus. Okay, so this corresponds the lower border of the cavernous sinus. Okay, the lower border of the cavernous sinus lies medial to the Meckel's cave, and exactly at the junction of, this is the trigeminal ganglion, at the junction of the middle and the upper third. Okay, so the lower border of the cavernous sinus does not include V2. Okay, the lower border of the cavernous sinus does not include V2. So you can see as the superior ophthalmic vein. So again, the third nerve, fourth nerve and the ophthalmic division converging at the superior orbital fissure. So this is the superior orbital fissure where it is converging. So again, this marks the lower border of the cavernous sinus. Okay, this is the lower border of the cavernous sinus. So here we will see various tributaries of the cavernous sinus, the most prominent being the basilar sinus. The maximum distribution occurs through the basilar sinus. And then here the lower border is limited by the, at the point where the internal carotid artery, the petrous carotid, leaves the carotid canal, exits the carotid canal. That is just below the petrolingual ligament. Okay, this is called as the petrolingual ligament. So at the point where this is the ICA, this is the petrous ICA, internal carotid artery. So this is the petrous ICA, this is the cavernous ICA. So the petrous carotid exits the carotid canal, the point at the level of petrolingual ligament. So this corresponds to the lower border of the cavernous sinus. So once again, we are now only describing the borders of the cavernous sinus. Okay. So now all the venous plexuses has been removed. Now what you see is only the trigeminal, this trigeminal ganglion, the posterior root of the trigeminal nerve, the ophthalmic division, the maxillary division, the mandibular division. The ophthalmic division exits through the superior orbital fissure. The maxillary division exits through the foramen rotundum, and the mandibular division exits through the foramen ovale. And also what you see here is the greater petrosal nerve. Okay, this is a greater petrosal nerve, the significance of which will be seeing in the subsequent slides.